this video.
Cesarean scar massage during pregnancy is generally not unsafe, but I would check in with my healthcare provider first just to get an individualized assessment. You want to find out if the pain or discomfort that you're feeling is in fact coming from your scar and not from the pregnancy itself, because round ligament discomfort is nearby. Straining in abdominals are also a possibility, pretty common during pregnancy. So get that checked out in person, then follow your practitioner's advice. The bleeding that this mom is describing is referred to lochia, and that's the vaginal bleeding that is natural after childbirth, whether after vaginal or cesarean birth. Now, when it starts to fade and then it suddenly gets bright red or increases in heaviness, that means that you have done too much physically, right? The bleeding is actually coming from an open wound inside of your uterus where the placenta used to be. So that wound is trying to heal. If you move too much, it's basically the same as picking that scar and then the bleeding ensues again. Okay, and I'm using too much in quotations because it doesn't necessarily have to be very much at all. So you want to utilize this lochia. The increase of lochia is a way of measuring if you are doing the proper amount and suitable amount of exercise and movement for you. A lot of women think that scar massage is the first step in cesarean birth recovery, but it's actually not. It's the second. Psychological acceptance of the experience that you've gone through is actually the first. So the psychology of healing is actually what I speak of first in both of my cesarean recovery programs, and that is the concept of accepting what has happened to your body enough so that you feel comfortable touching your scar, so that queasiness or the feeling of like, it's so gross, I can't even think or bear of the thought of touching my scar, let alone like rubbing it and massaging it. That comes from a root cause of guilt or shame, pain, fear, sadness, and that's something you may want to work through first before scar massage, because something you can do on your own. Let's answer this question in two parts. The best time to start actual physical massaging of the scar is after you are discharged by your doctor. And the reason for that is because you want to ensure, one, that there's no infection going on, and secondly, that the wound has closed the way it needs to close. All right, so then after you are discharged, and usually that's around the 6-week mark here in Ontario anyway, that's when it's safe to start direct scar massage. So the answer to the second part of this question, can you do it yourself? Absolutely. As a matter of fact, you are the ideal person to be doing your scar massage. Why? Because you can do it every single day, and that's actually what you want to be doing, is receive some kind of scar massage treatment every single day. Now, it doesn't take a long time, and the way I coach it is every day you commit 5 minutes to your postpartum recovery. Half of that time is your scar massage, and the other half is a movement that helps your body accept that scar massage and holds it. So, absolutely see a professional one-on-one, but at the end of the day, you're the best person to do it. So this is why I am running a free scar massage workshop this Friday. It is an introductory workshop, so please check it out. Here are the main reasons why you want to do scar massage after your cesarean. 1, it decreases your pain. 2, it increases your strength. 3, it improves the appearance of your scar. These are pretty much the side effects that you would expect if you learn to get your scar to not heal tightly and to have it not stuck down. So those are the big reasons why you would do it. And the research shows that there are other massively important impacts too, like improvement of your posture. Like if you're doubled down with this tight scar tissue, you can't stand straight. And that ends up causing a lot of secondary pain and injury, mostly in the lower back and your hips as well. So how often would you do your scar massage? optimally every day, but for just 5 minutes. So make sure you learn how, sign up for my free workshop on Friday. What is true for any surgery is that the stronger that athlete goes into the surgery, the better her recovery outcome will be. So I know it sounds kind of generic, but really the stronger you are going into your cesarean, the better your recovery will be, including your scarring. Why? Because you have a lot more vascularity, oxygenation, and more blood flow, because that blood flow is what helps you heal. So the prevention is getting strong during pregnant. And then the other big thing is understanding, the big factor